Good afternoon, ladies and gentlemen, members of the PenTAD, executive leadership team, and stakeholders. My name is Kenneth Berry, and I work for the VA Puget Sound Healthcare System in Seattle, Washington, for the Spinal Cord Injury Unit as an administrative assistant. Today, I would like to talk to you about health literacy. Health literacy can be defined as the ability of an individual to acquire, process, and understand general information in order to make a better informed decision about their health and their health care. According to a National Assessment of Health Literacy study conducted in 2003, it was found that 12% had proficient health literacy skills, while an estimated 77 million Americans had a health literacy of a basic or below basic level. In order to combat the decline of health literacy in affected populations, it is important that patient education materials play a vital role. Patient education materials should be provided in multiple formats and given to a patient after every visit. If you couple this along with the teach-back method, it is noted that health literacy increases, medical compliance and treatment regimen increases, there is a decrease in adverse drug events, whether one is underdosing or overdosing, and also it helps to address health disparities in affected communities as well. I propose that we initiate a renovation or upgrade of our current patient education materials, particularly the ones in the pharmacy where we dispense medication to our patients either internally or externally through our consolidated mail order program. It is estimated that this renovation project would take about 4 to 6 months and cost approximately $75,000. This project would be deployed in 5 phases. The first phase would be a logistics phase where we would identify the materials external that we would need to acquire for the project. Also included in that phase would be to where we internally identify those who would be working on this project. The second portion of this project would exclusively focus on those materials that we are going to upgrade and how we identified them. The third portion of this phase would include a comprehensive quality analysis based off of feedback from the hospital director, the chief of staff, the pharmacy director, and nursing services. The fourth phase of this project would include holding an internal town hall on national class standards and how it affects our facility. The fifth portion of this phase would be after all of the material that we have decided to upgrade has been printed, we would hold a community town hall inviting the community to the campus and give them a heads up on what we're doing and how it affects them. And we would also display our patient education material in the old format and compare that with the new patient education material that we were in the process of renovating. We would like their feedback to that. As you can see in this sample of our patient education handout that we give to our patients as it relates to a knee arthroscopy, it's not very visually appealing. The wording is clunky, the graphics are outdated, and this is why we believe that increasing health literacy will go a long ways in only better serving the patients that we care for and the facility as a whole. health literacy continues to be at the forefront of modern medicine as our populace grows and its diversity as well. I propose that if we are to be the tip of the spear in combating health literacy and being innovators in how we respond to it, address it, and tackle the problem head on in this organization, then we are the better for it. I ask that you look favorably upon this proposal, and in doing so, you would acknowledge that 1, health disparities exist, and 2, we recognize that, and we would like to take action on that. We also acknowledge that a patient's ability to read and understand medication instructions show our commitment not only to the patient, to the organization as well. It also shows our sincereness in wanting to help those that have borne the battle for us in this country. And it also demonstrates our solemn promise to advocate for those that cannot advocate for themselves because of a diminished health literacy. We are confident that we can meet these challenges head on, and we stand ready to partner with you in delivering a cost-effective and patient-centered approach to increasing the health literacy not only of the patients that we serve, but of the nation as well. Thank you.